6 weeks in a hospital with several infections, all of them acquired while a West Michigan woman was receiving medical care.
Well, this morning, Target 8 investigator Henry Erb follows up his report on hospital-acquired infections.
We met Anastasia Miller on the Kellogg Community College campus in Battle Creek, where she is taking a voice class and getting her life back on track.
We ended up losing our home and having to declare bankruptcy because I had to quit my job because I was hospitalized for so long.
Miller was a victim of what the Center for Disease Control calls healthcare-associated infections. That's a broadened definition. The CDC previously talked only about hospital-acquired infections, which it says infects 1 in every 20 hospital patients.
I had a fever of 103 degrees, and over the next 3 nights I went into the hospital, into emergency 3 times.
Miller first got sick at home while pregnant and receiving fluids through a direct line for dehydration. That put her back in the hospital.
They found that I had 2 blood infections, I had an abscess on my shoulder, I had a staph infection at the site of where the PICC line was.
Then, while Miller was in the hospital receiving heavy doses of antibiotics for those home care acquired infections, she got another infection, an intestinal malady called C. diff. It has become one of the common hospital-acquired infections.
I don't know, it was not enjoyable. A lot of cramping, a lot of pain.
After nearly 6 weeks in the hospital, Miller went home with a healthy baby, but lasting pituitary gland damage and crushing debt.
I didn't have any kind of short-term disability, and we lost everything because of our medicals.
Medical experts say that the healthcare industry used to view infections as a hazard that couldn't be helped, but our targeted investigation found that the healthcare industry in the last few years has been making infection control a priority. But Miller says her experience taught her that patients have to advocate for their own safety and speak up.
To ask questions. You know, when things are happening or you're starting to feel sick, to not let it fall on deaf ears.
I'm Target 8 investigator Henry Erb.
We have more posted on Target 8's investigation into hospital infections on our website, woodtv.com.